All right, so we're going to move on to blood pressure. As I said, as a nurse for over 20 years, I take a lot of blood pressures. We were just here, was it last week? We did the health fair. We were doing blood pressures for you. We know that they put the cuff on your arm, squeezes your arm really tight, it hurts, and then they give us a number. But most people don't even know what that number means. So the doctor says, well, your blood pressure's too high. Okay. So I get a lot of questions about, well, what is blood pressure? What are they reading? How do they even tell what it is? So when they're reading that blood pressure number, it's the measurement of how hard your heart has to work to push the blood out through your body. So when we put that cuff on, we're kind of stopping the circulation, which is why it hurts for a moment. It's necessary. And when we release it, that first number is how hard your heart has to work. And the second number is the number where your heart relaxes back into a normal rate and rhythm. The higher that number is, that means your heart has to work so much harder to push the blood through your body. As I said earlier, the harder your heart has to push that blood, the more damaging it can be to your blood vessels. Now, it's normal for our blood pressure to rise and fall during the day. It may be higher when we get up in the morning and then lower later on in the day. That's pretty normal. It's also normal for your blood pressure to rise or fall depending on what you're doing, right? If we were exercising, our blood pressure is going to be up. If we were walking through the parking lot and a car almost hit us and we kind of got scared, our blood pressure is going to go up. If we won the lottery, what's going to happen? Blood pressure is going to go up. However, when we stop exercising or when the moment of excitement passes, our blood pressure returns to normal. That's what's supposed to happen. Where we run into trouble, though, is when that blood pressure is high and it stays high all day. So they get those two numbers and they look at it. They really want to see your blood pressure at 120 or below. We kind of say 120 over 80 is the textbook normal. They're even saying for seniors 65 and over, they'd like to see it even lower than that. They consider high blood pressure, or what we call hypertension, anything 140 over 90 and above. So if your blood pressure is consistently at 140 or higher, it can be very damaging over time to your body. That's where the doctor, may recommend both lifestyle changes and possibly medications. So it's really important to see the doctor regularly. Have your blood pressure checked. Make sure that we're doing okay, and if we have high blood pressure, to make sure we're taking steps to keep it at a good level. They say at least a quarter of American men have blood pressure that stays dangerously high all the time. The scary part is most men aren't aware of it. Most cases where they see a man that has a cardiac arrest, a heart attack, sudden, didn't even know that he had heart disease or high blood pressure. We call it the silent killer because a lot of times with high blood pressure, we don't even have symptoms. If it's really, really high, we may have a throbbing headache or we may be very flushed and hot. But if our blood pressure is at 150 over 86, we may feel fine because the body's learned how to compensate, but it's still very damaging to your blood vessels, and over time, as I said, can be the #1 risk factor for heart attack, stroke, and heart disease, heart failure. So it's really important that we keep that controlled. All right. The good news is that with lifestyle changes and medication, it can be controlled and we can live a very normal, healthy lifestyle, hopefully for a very long time. But we do want to make sure that we're having it monitored. Now, some people ask me, can they buy those cuffs that go on their wrist? I'll tell you as a nurse, it's not the most accurate as far as the number, but I always say if you're using the same machine to do your blood pressure at different times of the day and a couple times per week, as long as you're using the same machine, you can kind of get a good picture. Is my blood pressure high, then low, then high? So that when you talk to the doctor, you can say, I've been checking it at home with my cuff, and this is my numbers, this is what I'm seeing. Of course, you can go to like a Walgreens or a CVS and you can put your arm in the machine. Some of you may have home health or hospice that comes to see you, and of course, they'll be checking it every time they come to see you. That's pretty standard to check your blood pressure.